Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of my lecture is the pathophysiology of wound. Now, wound is a very interesting topic and it's forensically very important as all the case hearings are based on the description of the wound that the forensic experts give while writing down an autopsy report, or either it can be a medico-legal report, as in cases of street brawls, for example, or the road traffic accidents are also very important, in which a forensic expert has to write down the details of all the wounds that were observed on the victims. And the details have their own scientific terminologies. So this lecture is based on the first section is the classification of the abrasion and the classification and forensic anatomy of the skin, the tangential, crushing and fingernail abrasions. And here we'll also discuss the patterned and the post-mortem abrasions in detail. The second section mainly comprises of the contusions and the bruises, which are also a part of the blunt weapon injuries. The types and the factors affecting these bruises are discussed in detail in the second section. Moreover, we'll be discussing the movement and the alteration of bruises with the passage of time. The bruising of special significance and kicking, which is a phenomena seen specially in the street brawls, is discussed in this section. Thirdly, we'll be discussing the lacerations in detail. Now, lacerations are also included in the blunt weapon injuries, and they contain the patterned lacerations, the blunt penetrating injuries. Incised wounds are a part of the sharp weapon injuries, and they're also discussed in this section, including the cuts and the slashes. The fourth section, we'll be discussing the stab wounds or the penetrating injuries. Now, stab wounds have their own classification. That is discussed in this section, the nature of the stab wounds, the characteristics of the stab wounds, how are we going to describe a stab wound when we come across it, and injuries by weapons other than knife. That includes, of course, the razors, the scissors, or any sharp objects that come into play. Now, the fifth section lastly consists of the dating by the histology and the histochemistry. Histological changes after wound infliction, they are discussed in this section, the histochemical changes in the injured tissues, and the survival period after wounding. That is very important because that is the time period that is critical and the person needs the first aid. So that is discussed in this section. I hope you want to learn more about this pathophysiology of wound. So do watch the other sections of this lecture as well. Thank you for watching sqadia.com.